This is a review of a new release of NeuroGuide. The Navigator will be in the next release of NeuroGuide, in which we've improved the quality of the shading for the head model here. You can see this is the scalp EEG, actually. We can view in real time. I'm going to remove the scalp, and inside you can see the cortex, and I'm going to remove the cortex now. And we can begin to look at slices. And most importantly, I want to show the diffusion tensor imaging fiber bundles. There are horizontal, coronal, and sagittal slices here. I'll bring it back around, and I want to take the slices down a bit, at least the axial slice, so you can see things a little bit easier that are deeper inside the brain. This is used to assess in real time or by assessment after you've recorded the EEG and edited it. The aspects of the EEG are significantly deviant from normal. So I'm going to remove the slices now so we can just look at the diffusion tensor imaging. I'm going to keep the axial slice so it's easier to see as a landmark, the fiber bundles. And then lastly, I'm going to remove the fiber bundle, the axial plane, and the head model. I'm going to expand the size of the diffusion tensor imaging fiber bundles because they are very beautiful. These are the coronal sections, the fasciculi from the occipital frontal region, temporal frontal fasciculi, corpus callosum, the fiber bundles. Now in the future, we will be coloring these bundles depending upon the connectivity in the brain, whether it's affective connectivity or functional connectivity, that is a correlation. If it's high connectivity, then the fiber bundles will be turned red. If it's low connectivity, they will be green or blue. Then we'll have neutral colors in between on the spectrum so you can evaluate the distance from normal of a given subject's brain and their connections as you evaluate the brain in ways that previously could not be done because of the absence of advanced technology like we have here. And I'm going to add the axial slice again. And I'll bring the face back. So you can see that everything is okay. And so anyway, this is a quick review of what we'll have in the future in just a few weeks in both real-time Navigator and for assessment. And you can actually use it for biofeedback. We'll be able to evaluate deviations from normal, and you'll be able to then try to reinforce greater stability and efficiency in those hubs and networks that are linked to your patient's symptoms.